Welcome to today's call, everybody. We're going to be focusing on uh, general questions around reopening and specifically any of the operational questions. So we might stay away from some of the hygiene and cleaning related topics, at least in any sort of like real detail, and focus on some of the business aspects and some of the policy and procedures that you guys might be thinking about putting in place. Um, as always, I'll give you a quick little tutorial on Zoom for anyone who's just joining us for the first time, go over some basic ground rules, give you a little bit of an update on what we're working on and what we've seen over the last week, and then we'll just dive right into this brainstorm session. So while we're in that brainstorm session, you can chat amongst yourselves with the chat tool in Zoom. That's just at the lower center of your screen on the left-hand side. When you do chat, make sure you select all panelists and attendees so that everyone can see your comments. Otherwise, it'll just be the CWA who can see what you're typing in. Any questions that you have that you'd like to put to the larger group, you can type into the Q&A box and upvote those with a little thumb. That way, the most urgent questions get addressed. We had a ton of questions in our last hygiene brainstorming call. I'm hoping we have that as well. Anything that we don't touch on in this call, we'll make sure to get answered later in our Lines newsletter and on our website for you guys. This is a brainstorm, so I definitely want to hear from all of you. Questions, comments, ideas, suggestions, anything. So if you'd like to say anything out loud, just go ahead and click raise hand at the lower center of your screen, and we'll make sure that you have a chance to speak to everyone. When you do raise your hand and you get unmuted, you'll just get a little pop-up. Make sure you click unmute myself, and as soon as you do that, you'll be ready to speak. As always, we have some pretty simple ground rules. Just be polite and respectful of each other. No personal political commentary. This particular topic should be a little bit less urgent for that. And then anytime you have a chance to speak out loud, just limit your comments to around 2 minutes. That way, there's time for everyone to speak up. We had a little bit of a development since the last time that we all got together, and we had our first international group call with a large number of organizations, and I think a growing number as well. We'll see as we continue these calls. So. The major climate organizations around the world have kind of banded together to help share information and develop any of these guidances and best practices as closely as possible. There'll be a lot of regional differences based on different local governments and different public health authorities. Even in the United States, every state's going to be a little different. But I think it's going to be really critical that that all of us are working together to vet the information that we're providing you guys, and then also to develop it at a more rapid pace. And that should make any discussions that you have to have with local regulators just that much easier, because you can lean on this huge body of knowledge that we're trying to gather for everyone. Little update on where the world stands. It was really elucidating on our call yesterday with that international work group, seeing what other countries are going through. We're all pretty much seeing the same questions and having the same issues to work through, with just some very little differences. So the burning question for everyone, for the last number of months has been, when can we reopen? We've seen some really rapid development on that in the U.S. With the new announcement from the administration on the 16th. I'm sure everyone here is intimately aware of all those goings-ons. We've had our first gym in the U.S. open last Friday on the 24th, and by all reports, that went fantastically for them, and they're happy to be there and open. Um, Timelines for the rest of the states and the rest of the gyms, I think, are going to be a huge variety of answers in the U.S. Might see some more gyms opening up this week. Probably a lot of you will be opening up in May at some time, and then I think a few, especially in some heavily impacted communities, might be looking at June as a reasonable timeline. It's just going to be a very piecemeal approach based on the individual, like hyper local situations. So even, for example, New York State, which is extremely heavily impacted in the major metropolitan areas, might be opening up upstate New York a little bit earlier than some of those more metropolitan locations. Talking to all of our international colleagues, it looks like most people are targeting a mid-May to late June timeline with a variety of dates in between those two bookends. So, some of the things that I think we can say pretty concretely now is, as we're planning to reopen, uh, you're going to have reduced check-ins, whether that's mandated by your local government or just a practice that you put into place. So as you begin to do your financial planning and business planning around this, that's one that, if you're not already aware of it, that you're definitely going to have to take into account. And some of the numbers we've been seeing, I think, are going to be pretty low. All this is still in development, so no real concrete numbers. Our friends in Georgia who opened up were limiting their occupancy to 20 people at a time. Some reports from a few different countries in Europe are talking about a 10-meter square radius around any individual, so 100 square feet, which is quite a large area. And some smaller facilities could lead to maybe even single-digit occupancy for certain gyms. So all of that's in development. We'll just have to see how it progresses as we move forward. But just to let you guys know some of the data that's out there right now. And then I think that as you do that planning and forecasting financially, parties, competitions, events seem like they're going to be pretty slow to return. And everyone is probably already assuming that to some level, but by slow to return, I mean, maybe even looking into like 2021 for certain areas and certain gyms. Again, rapidly developing, but just reports I've heard from other gyms, other countries, other competition facilitators. That seems like a fairly good likelihood that for a good number of people that could be the case, that 2021 will be when you can start looking at those types of activations. And then lastly, I just wanted to mention, as we're starting this reopening discussion, I think it's important to include also a rebuilding discussion. It's not just about getting your doors open, but it's how do you get back to where you were 3-4 months ago when things were more normal. And that time frame might be, it's going to be different for everyone, but that time frame might be fairly long at this point. It's hard to tell when the pandemic will actually end. So as you're planning to reopen and you're planning your rebuilding strategies and scenarios, just set appropriate expectations and plan for the worst, hope for the best kind of thing. And as always, just make sure that communication with your customers is at the top of mind. Let them know what you're doing to make them comfortable once you do reopen. Let them know what your policies are as you reopen, and then once you do reopen, make sure you're constantly communicating what your expectations are of your customers. So that's hopefully the end of me talking for this call. And yeah, so I'd love to hear from you guys. We've got one question out there already, so I'll just go ahead and ask that, and hopefully someone will throw their hand up and answer that for us. So a question for all of the operators out there: if you open immediately once you're able to do so, or are you going to wait for a certain set of conditions in your community? Does anyone have an internal discussion with your staff and or maybe your co-owners on what sort of conditions you're looking for in your community before you reopen? All right, we got let's hear from Kristen. I think you're ready to go.
No.
Oh.
Okay, there you go. Is it good now?
We gotcha.
All right, sorry. This is Kristen from the PADS Ascent Ventures. I actually surveyed my members last week, and of our across three gyms, the overwhelming support for opening day one without us restricting it made it very clear to us that we're not going to stop ourselves and look for conditions. We're going to wait until, we're in the West Pack or whatever it is, where they all the states are working together to determine when to do stuff. So they feel comfortable that when we're open, we should open. So that's what we're going to do.
Great. And how about you, Jamie? You're in one of the harder hit areas. Yep. And Jamie Harpster, just to make that a bit more clear. See, do we have you, Jamie? Nope. Okay. Yeah. Is there anyone out there who's not planning on opening day one as their state or city allows? All right. Let's hear from Bradley.
Yeah, so the situation here, this is Bradley with Elevation Rock Gym. We're in northern Utah, and we're kind of waiting to see public opinion. We, I think, could have opened 2 weeks ago. So yeah, Utah doesn't have very strict restrictions, at least not where we are in our more rural area. So yeah, I'm kind of waiting to see what public thinks, and I'm also trying to just, I've been trying to reach out to the other gyms in the state to try to do a response together, just to kind of, all be on the same page and kind of present a united front, at least locally, on that. So yeah.
Great. Thanks, Bradley. And John, we'll get you in here. And yeah, if you could say what gym you're from as well, that'd be great.
Yes, hello, this is John Burkhart. We're in a little bit of a different situation than a lot of other people. We're about to open. We're building a full-service climbing gym in Morgantown, West Virginia. And we wouldn't have been, so West Virginia, the governor yesterday released statement and guidelines based on meeting certain metrics related to disease incidents. So the initial guidelines were like 3 to 6 weeks from now, gyms would start opening in a phase 2 of reopening. We probably won't be able to be open in that timeline anyway. We might have been able to be open around those times if the coronavirus has slowed down construction and appointment of the facility and all that. So I guess we're just trying to, we have a lot of uncertainty. Most of the questions around that we have are, what business model will we open with? I think that's our main area of uncertainty, is we're not sure if that will be able to open with a membership driven model, really. We've done some assessments of our business model, and it seems difficult to make enough revenue to cover expenses if a person can make an appointment basically and come whenever they want. Even if it's appointment driven, if they can just come whenever they want, you're still not making enough money per time that the gym is open to be open. So we're actually considering like a business model that'd be more like a trampoline park or something, amusement park, which is not typical climbing gyms. We know that. But where people pay $15, $20 or something to come for a 2-hour time slot, and it'd be restricted. The facility would have restricted usage. That's one thing we're considering. And if we were able to fill time slots or get them close to filled, there would be more revenue. That's kind of something we're considering.
Yeah, that's an interesting approach, and one I haven't heard directly from a lot of other operators around is for any gyms considering time slots, what you do with the member versus day pass question. Do you change your day pass prices at all? Do you just keep it members only? So that might be one that we can bring up in this discussion as well, see what people have been thinking around those areas. And we've got Jamie with us now, and you should be ready to go, Jamie, I believe.
Let's see if that works.
Yep.
I'm on my phone. All right, cool. Yeah, Jamie here from the Gravity Vaults. we kind of felt like even if the state or the local government told us that we could open, we needed to make sure that the facility and that our customers were prepared to open. So, you know, kind of a few step process, that, you know, facility preparedness with flow and kind of if we have arrows on the ground, or, you know, as far as a plan with route setting and shutting off certain rope stations to keep spacing, as well as staff preparedness, and then customer preparedness. And making sure that the customers are aware of the expectations that we have of them when they come into the facility, as well as to not jar them when they come in. To, you know, a customer thinking that they're reactivating their membership and they have full use of the facility, versus saying, hey, the fitness area is closed off for the next month, or, you know, hey, we have 100 rope stations, so only 50 of them are going to be available per day type of situation, as well as making sure that the staff over the next couple of weeks, we're kind of hoping for an end of May, early June opening. Just make sure that the staff are well prepared in addition to that, because most of ours have been furloughed or temporarily let go. And then last but not least, you know, in the case of a reclosure, either government-wise or self-imposed, that have a quick action plan for that. So just making sure that we have multiple steps in place, just and opening that way, as opposed to just saying, okay, the government said we could open, so we're going to open. We don't want to, like we talked about in the call last week, you know, damage our long-term reputation by opening unprepared.
All right, thanks, Jamie. And yeah, having an action plan for reclosure, I think, is an excellent thing for everyone to be mindful of. Let's see. Does anyone else have want to throw their hand up if they want to weigh in on this question about whether it's either the time slots or whether you have any criteria that you're going to self-impose before you reopen? All right, let's hear from Elizabeth Garcia.
Hi, we own a small gym in Northern Illinois. I know we've been taking this time to get a lot of renovations and work done. I think a lot of people are. And we've had a lot of members, because we're a small gym, keep their memberships open. I know when we reopen, to help kind of train the staff and ease everybody in, we're going to be opening just to members for the first 2 weeks who kept their membership open. That way they can get used to the flow and the expectations. We can let our staff get used to the expectations. We're not going to do a time schedule right now, because we're small enough that it's not going to be too big of an issue for us most of the time. Weekends we're going to get a layout, and then once we kind of see how it flows with the members, we're then going to adjust how we're going to be opening to the public. And we think we're going to do strict hours for the public, and if people want to climb more, they're going to have to get a membership or punch pass of some sort.
Okay. Thank you very much. Let's see. I thought there was one other hand up. No? Okay. Let's move on to the next question. This is a great one. If anyone's planning on requiring face masks, got a couple upvotes on that. For a few cities out there and a few states, potentially, that might just be not your choice. There's, in addition, just to expand on this question, there's kind of two elements of that. There's the requiring or providing face masks for your customers, and requiring or providing face masks for your employees. So has anyone out there worked towards those guidelines, either just as a self-imposed thing or having to deal with it as a state or city mandated request? All right, looks like up in Larimer County, Larimer County, Colorado, they are requiring face masks for employees and customers. There's some OSHA guidance as well that you can follow to look at the different risk levels that certain staff have. So that's a great one to lean on, and there's a link to that on the CWA's coronavirus resource site. I see Kristen's got her hand up again, so let's hear from you, Kristen.
We actually just spent yesterday, we had a conference call with all our staff, and I did that survey, and it was very clear to me that if we impose restrictions on our staff, or not our staff, our members, that's going to force people to choose not to return versus choosing to. So staying outside of what's recommended, I really want to advise all of you that, I guess here's my speech that I gave my staff, which was basically, hey guys, we're a rock climbing gym. You know, it's always going to be dangerous. We do our best to mitigate risks, but there's a big old waiver we have to sign. Our insurance company understands that. You know, like us personally, we always kind of joke that we like aren't Boy Scouts where we're overly redundant. So what we're going to be doing is modeling what we'd like people to do with our staff by protecting them, by making sure that they follow our sick policies, they have masks, they you know, make sure their hands are washed, we have sanitizer for them. But we've decided that we're going to allow people that go into it, as long as we are allowed to have the choice of how they want to navigate our space. And one of the things that with the survey, it was very clear that for everything that we impose, we're going to lose anywhere from 3% to 20% of our members. So just think about that, guys, when you guys are calculating how you're going to reopen and what you're willing to lose while you do it, I guess, if that makes sense.
Yeah. Yeah, that's great advice. And I think a lot of these operational and policy decisions that everyone's going to have to be making, that's going to be the scales that you have to look at every time. Is almost any decision you make, you're probably going to be affecting some people, and you'll have to make that decision for your community and what you think is going to resonate best with them. Let's hear from Audrey.
Hi everyone. I own a small climbing gym in Springfield, Missouri, a Zenith Climbing Center. And what we're doing, we actually are opening to members only on May 4th. So here in just a little under a week. And we have purchased one of those outdoor sinks, and we're going to have people wash their hands before they come in. We're not requiring that guests wear masks. However, our staff will wear masks, at least at first in the first few days, and then I guess we'll just see how it goes from there. But those are just a couple things we've done so far. And yeah, we've just gotten hand sanitizer everywhere. So that's where we're at so far, but I guess we'll just have to see how it goes and listen to our local authorities on that.
Yep, just leave it like that. I'll help put it away. Can you put away all your slides for me though, please?
Great, thanks, Audrey. And
Yeah.
that's a great card I'll add to.
What is going on? Oh, sorry.
That's a great card that I'll add to our matrix here. You know, entry requirements. Maybe I'll title it. So things like washing your hands before you enter the building, or any sort of any sort of requirements that you might have to enter the building, whether that's face masks or hand washing, etc. And just to move on from the face masks, and that's a great segue, because one of the other questions we had on here is about those kind of entry requirements. So I have a question about whether gyms out there, how many gyms out there, if any gyms out there, are planning on requiring temperature checks or any entry surveys. You know, whether you have a new cough, if you're sleeping okay, can you smell and taste things like you normally can, those kind of questions. Anyone out there considering implementing those specific procedures? Let's hear from Laura Villarreal.
Hi all, I'm Laura with Bouldering Project. We are drafting up a reservation widget in RGP where folks can reserve time slots, and then after they confirm it, we have a number of yes/no questions for them to confirm before they complete the reservation. One is confirming that they have not experienced any of the now 9 symptoms of COVID, or been around anyone who has a confirmed case of COVID for at least 14 days. We ask them to say yes or no. And we also ask them to check yes or no that they agree to adhere to our behavior recommendations in this space. So we want to balance like having confirmation, or at least folks being aware of the symptoms and confirming that they don't have them, while also not capturing like highly sensitive health information.
I really like that approach of doing that in some digital fashion prior to the customer coming to the gym. It answers a lot of the questions about privacy that that have come up in some of the previous calls. You know, where do you ask those questions? How do you ask those questions? And I think it also does a really great job communicating to your customers, you know, how seriously you're taking the situation. Um, so I think that's a great approach. So we've got another hand raised from Jason Mullins.
Can you hear me?
Yep, we got you.
Hey, Jason Mullins, Rocks and Ropes in the block in Tucson. We've done something, I've started a matrix very similar to the Rock Gym Pro. I mean, it's just kind of a fuzzy area and how much, like you said, like, you know, privacy issues and whatnot. So, I mean, we basically said like, you know, I'm willing to adhere to the policies and, you know, I have been practicing, you know, social distancing. We also, I've included for now in this template that, I totally forgot what I was going to say. Oh, that we're going to adhere. Oh, that I acknowledge that I could be risking myself to exposure by walking into your facility. You know, I mean, short of like another waiver or something, like we don't want to add any of that. So that was about it.
Okay, great. Thanks, Jason. Let's see. Moving on to the next question here. I had a question. It was a great question about hand sanitizer. I believe, and chime in if I'm wrong, Audrey. I believe I caught that you mentioned that you had a hand washing station rather than a sanitizing station. And by all accounts, as far as the science and medical community is concerned, hand washing and hand sanitizers are pretty much equivalent. So if you do have trouble sourcing hand sanitizer, or even just the dispensing stations and equipment, that hand washing could be a good alternative. Not sure if people have faced any challenges finding those kind of stations or adding them to their facility. But if anyone has any advice there or any other ideas, I'd love to hear it. Go ahead and throw your hand up. All right. So see, the next question we have on here is in regards to group events. So once you're open, will you host group events such as field trips, birthday parties? This owner is debating reducing the capacity of the events rather than discontinuing them altogether. As I mentioned in my little preamble, some of the information I've heard from various competition federations around the world, it looks like very, very late this year to early 2021 is the timeline where they're seeing competitions as being possible at the moment, which you know, somewhat equivalent to any sort of group event, I would say. Has anyone out there started any planning, either in your just business planning, financial forecasting, situation modeling, um, around group events with any sort of eye to a specific timeline? Okay. Um, let's see. Another question in here around around finances, and a little teaser, this Thursday we'll have a panel discussion regarding financial planning and probably some scenario modeling as well. So for some of the like hyper details on that question, tune in on Thursday. This question here is, do people feel like they're going to be able to cover their expenses given assumptions about reduced usage due to time reservations, reductions in programming, et cetera? So that's a continuation of that further question we had around time slots and whether that's an alternative business model to memberships, or whether maybe maybe those time slots are only reserved for members and you choose to discontinue day passes or walk-ins. Anyone out there leaning one way or the other, or have a strategy to service both of those customer bases? All right. Yeah, sorry for not having an answer for you there, John. I think that's something we'll just see how it goes as gyms begin to reopen and start navigating some of these waters. Okay, next most popular question here. Are folks developing different plans for if or when there are additional waves of infections before a vaccine becomes available? For example, agility and flexibility to add restrictions or ease restrictions as things fluctuate until there's a vaccine. I think that's a great question. Jamie touched earlier on their plans to have an action plan in place for any sort of reclosure or eventuality like that. On the more positive outlook, which I love that this question brings up the positive side of as things begin to ease, what restrictions can you roll back on, and how do you do that, and how do you continue that constant dialogue with your customers so that they know their expectations. Anyone out there willing to share any sort of phasing or planning they're doing for scaling those types of situations, or even on the negative side, responding to any potential closures, reclosures in the fall or perhaps next year? Yeah, and all of these questions are pretty tough, so it's totally fine not to have answers. Let's hear from Kristen on some thoughts on that.
Oh, it's always me. Sorry. We went through and realized my approach was, what changes can we make that are permanent, so that when we introduce this, we can train people how to do things. So we actually have a 2-phase plan, and the first phase is prior to opening. What things do we want in place that will actually last forever? That includes like not overfilling yoga studios and like determining what ratio we have for that. What's our ratio for setting for? I'm a very member-oriented business model, so at what point, how many members do we have before we introduce another yoga class? How many members do we have before we need to really have another staff person? And analyzing that and making it actually a proactive way to realize how you're going to continue to increase services as you go along, which also means that we're kind of almost back to startup phase, realizing, I don't know what all your guys' numbers are. We continued to keep members supporting us through this. So and again, like I said, my survey says I'll have about 50% of what we were when we closed. So knowing we're going to have 50%, this probably answers, I think it was John's question too, means that we know we're in startup phase again. So we're going to have to cut services and cut staffing to support that, and then proactively grow. And then the other phase that we have is phase 1, which is opening under coronavirus. What are our policies going to be in place based off knowing that we're going to have reduced membership, but then being able to scale up? Because one of the things I'd recommend is do not open with promises you can't keep, and try not to reduce, but always increase. So that's kind of what our phase is. In terms of what we do after that, hopefully if we have the plan in place for pre-opening, where I have all these different policies in place, I think it'll allow us to not have to have like, okay, phase 2, it'll be led by the staff and the members. So that's kind of what we're looking at. And then it allows us to shut it back down if we need to.
Yeah. No, that's great. Thanks. Not to put you on the spot, and anyone else, feel free to answer this question, throw your hand in the air. But for you, Kristen, when you're talking about reducing services, are you looking at limiting access to fitness areas, discontinuing in-person yoga, coaching, those types of services, or anything in addition to that?
So my response is to be less planny and more reactive in a positive way. My staff are used to me doing this. So basically what we're doing is everybody is prepared to operate at full speed as well as operate at minimal speed. So we're looking at what our budgets are depending on that and what it looks like. Are we planning on implementing anything? Absolutely not, because one of the things I have learned is how much energy and stress can you spend planning, and then everything just gets thrown up. So what we're basically going to do is see how it goes. Like there's a couple of things where we kind of got into, like, we had all of our managers who got into like, not a fight, but like heated arguments that were like, we'll just see next week because we don't know what's going to happen. We have things in place. And again, like I said, people are going to be able to respond to what they need to. My guess is we're also staff led. So if our instructors are like, I feel fine if I'm wearing personal protective masks and I'm doing my hand washing, that I feel that this is a risk I'm willing to take on, then we're going to allow them to instruct as long as we're allowed to instruct. If There's no thing in place for fitness. You know, like I said, part of the pre-opening is making sure we have really nice cleaning schedule that doesn't change for the rest of our operations. Then if everyone's comfortable using it, then great. My thing was not to become a nanny state. I see a lot of the gyms kind of reacting the way, like, how do I keep people safe? But the way I see the gym in general is, look, we're providing a facility that they have to have their own responsibility for safety. We've all been through this close down, so everybody kind of knows why and what they need to be doing. And as long as we're protecting ourselves and our staff are leading what we decide to do, that's kind of where we're at. So I think it's going to be a continual check-in on temperatures of how people feel about stuff.
Yeah, I think that's a great comment. And there's a little a blurb in the chat here that's a great bookend to that as well. So for gyms who aren't requiring certain protocols for customers, do they have any extra liability or risk potential in terms of not protecting members to the best of their ability? And I think that's going to be a question that's going to take a long time to answer, and one we're definitely looking at and talking to insurance carriers about. But it's a pretty thorny legal issue. In general, like the early guidance that we saw was that for the most part, all of your liability policies are going to exclude most communicable diseases that that could potentially originate in your facility, with the additional caveat of it being incredibly hard at this point to determine, that someone actually contracted COVID or any disease in your facility. So we'll definitely keep that question at top of mind, but it'll probably be a while before there's a good answer for it. All right, a couple more reservation questions, and maybe I'll mash these in together. So if as you guys raise your hands, you can address both of these for what you're planning on doing. Great question. If anyone's asking customers to limit the number of times that they reserve those time slots during a week, someone's looking at doing that for some of their prime time slots. And an additional question about that time reservation, how early before the time slot are you allowing people to make reservations? So for a 10 a.m. reservation, can you make it at 9:45 a.m., for example? Anyone have any policies that they've currently put into place? All right, Laura, let's hear from you.
So we are starting with asking opt-in members to limit reservations to 3 times per week. We're not actively policing this, or we don't expect that we'll need to soon. We are starting each reservation, we're asking folks to stay for 2 hours. We're starting each reservation on the hour and the half hour, so it'll be rolling reservations coming in every half hour to help reduce crowding. And we are right now capping that at 20 reservations per time slot. We have our draft widget set up right now to show 2 weeks in advance, so folks can make reservations this week and next week, and the reservation spots close 2 hours before they begin.
Great. Let's see. Anyone else on the time slots? Any other similar policies out there, or different policies that could add to that? All right. Let's see. And I'm going to lump another couple questions in again. Someone was asking about that 10 square meter area. And yes, that's a number I've heard from a couple different countries in Europe. So let's see. They're asking about like the exact boundaries of that. I think that's going to be very facility based. You're going to have to look at your layout, and yes, that would be so 10 meters by 10 meters. I'm sorry, 10 square meters, so 100 square feet, 10 feet by 10 feet square, basically around an individual or group in the center. And I think it's important with some of those numbers. Remember, it's not individuals, but co-risk folks, so people who are existing partners or come from existing households. So that's another thing that might be an interesting policy when it comes to some of these social distancing guidelines to keep in mind is more than likely people need to be coming to your gym with you know, an existing partner, and probably, and this is something that would most likely be placed on them, but you might wish to communicate to your customers that they'd want to limit most likely the number of partners that they're climbing with to reduce overall risk. And a piggyback question to that I see in the question and answer dialogue here is, how are people determining how many people they'll allow in at any one time? For anyone who's come up with a number that they're working towards, are you taking your total square footage and dividing that by a certain number? Are you looking at the specific areas that people could be in, the size of your bouldering area versus the size of your entire gym? Love to hear a couple different strategies around that. It's going to be a pretty unique challenge to a lot of different facilities. And we've got Brian. I'll unmute you right now.
Hey, Garnet. We went through our entire gym and just kind of divided everything up into climbing zones that we felt like would keep people at a pretty good distance from each other. Approximately 12-foot zones, which is you know, more or less 2 draw lines on our rope climbing areas, and you know, the same kind of zone in our bouldering areas. And assuming that we have 2 climbers per zone, either a lead climber and a belayer, or a boulder and a spotter in each one of those. We just kind of counted up our capacity in the gym, and we came up with 98 people. Our occupancy limit for the facility is 390, so at 25%, that comes up to 97. So it's really pretty amazing that those 2 numbers really lined up with each other. So at least for our facility, 25% of occupancy load seems to work out pretty good for us. I'd recommend that people maybe go around and do the same exercise and just really imagine how many people do you think you can get in your facility, the way the terrain is laid out, and you know, keep people at a distance from each other. For our group exercise rooms, we're kind of going off of approximately 100 square feet per person, and we feel like that will spread people out on yoga mats so that there's at least 6 feet apart. Yeah, and then for fitness areas, we'll probably close every other treadmill, you know, that kind of thing, to try and keep people apart in those areas as well.
Great. Yeah, thanks, Brian. Did you guys also look at, so it sounds like you have your gym divided into a number of zones. Did you look at any alternative methods that would have given you either a higher or lower number of occupancy before you settled on this method?
No, you know, like I said, I just calculated it 2 ways, and both numbers came up to be about the same. Okay. So I said, well, that seems like pretty good. And I don't think we're going to start off with quite that many. We're, you know, our first week, I think we're going to probably go a little lower, maybe 20% occupancy load for the first week, and just see how things sort out. Make sure that there's enough room for people to move between zones, and you know, we're not creating overcrowding. And then as we feel good about it, we'll increase it based on the you know, what the state will allow us to do. Because I'm sure that the state is going to tell us that we can do 20% or 25% or 50%. I know right now in New Mexico, the grocery stores are supposed to do 20% of their occupancy load according to state regulations.
Oh, great. And just to keep you on the hook, Brian. So one of the other questions that I saw in the dialogue box here that's related to this, and your, I think your situation, we were talking about climbing zones, is a perfect segue into this, is managing the flow of traffic in the facility. Have you considered any walking lanes to these different climbing zones and fitness areas that you've laid out? That could be something along the lines of limiting traffic to a one-way flow through the facility so that people aren't crossing paths excessively. Any thoughts in your facility around that?
Yeah, our facility for the most part is pretty open, and we have talked about in some of the pinch point areas, possibly defining a one-way traffic area. Probably the biggest pinch point that we have an area with auto belays that are more advanced auto belays, kind of member-oriented auto belays, that is close to our bouldering area. And so we feel like there is potential for a pinch in that area where people won't be able to get away from each other. We are potentially considering maybe just closing down that section of the boulder to keep people out of there if it becomes a problem. And then definitely defining social distancing, spacing on the floor with tape, or Velcro on any of our carpeted areas. Gonna try and use some red Velcro on the carpeted areas to just define where zones of 2 climbers can be or not be. And then on the floor, if somebody is waiting to get onto an auto belay, for instance, we'll have like a defined on deck area and then a waiting line with 6-foot stripes.
All right. All right. Thanks for that, Brian. And I got Rhonda Tai here as well. I'm just gonna get you in on this topic. Let's see.
Thanks,
Should be all
Garnet.
set.
Not Rhonda. It's Walson Tai. I'm
Oh.
just using his account. But I found what Brian was saying was really interesting as well. Just on the zones that he was talking about. Has anyone thought about once you define zones, or we call them section and areas, sections being the physical attributes of the actual facility, and then areas being the sections, places within the section. So if you have a first floor or second floor, then that would be a section, and then the area would be defined in that, where it'd be the bouldering area or bouldering 1 area versus bouldering 2 area. But has anyone thought about how sections and the number of people affect booking times? So how you're going to take your bookings and how many bookings you're going to take, if you're going to do it in half-an-hour intervals or in 90-minute intervals, depending on how your areas, how you define the areas and how areas there are in a specific facility. Am I diving too deep in this?
No, I don't think so. I think that's going to be a challenge that a lot of people are looking towards. Yeah, go ahead, Brian. I see your hand raised.
Yeah, so, originally that was kind of the approach that we were going to take, Walson, is we were going to have reservations for bouldering, reservations for sport climbing, auto belays. And we just started thinking about how confusing that was going to be for customers to make reservations, how confusing it was going to be for us to make all these reservations and manage it. And so at least to start with, I think we're just going to do one type of reservation. We are going to do a separate reservation for our fitness classes, our yoga classes. And, initially it's a pretty small room, so we're only going to have 6 people in that. That's going to take 6 slots away from our general climbing reservations at that time. But other than that, I think we're just going to try and keep it simple, and hopefully with the lower capacity limits, it'll just sort itself out. As we start trying to get, increased capacity limits and get more people in the gym, we might have to get more complicated and allow people to make a bouldering reservation or a sport climbing reservation. But to start with, we're not going to do that.
Great, thank you for that. And another person on this topic, Lillian, gonna go ahead and unmute you.
There, can you hear me?
Yep, we got you.
So I think that for us, we're waiting for, mandates from the governor about how many people we can allow in the gym. But based on that, my director and I walked around the gym yesterday, and we also sectioned off areas we thought would be zones, number one. Number two, then we sat down and looked at time slots. We're normally open from 6 a.m. to 11 p.m. Monday through Friday. So we were thinking reservations we're going to take online. And when you go online, there's going to be also a list of our quote COVID rules that you would have to agree to while you're making a reservation. So we're trying to incorporate that so people know the expectations before they come to our gym of, you know, wearing masks, washing in their hands as soon as upon entry, et cetera, et cetera. But then when we figured out, we kind of thought, well, maybe 50 people in a gym, which is not much at one time. And we were kind of breaking it down Monday through Friday, about 6 a.m. to 7:50 a.m. So we're doing an hour and 50-minute time slots with a 10-minute changeover where, you know, people are leaving. Our staff are able to, while they're continually cleaning, while, you know, during the day, they can at least wipe down handles and all that stuff with that 10-minute transition period. So we would kind of break it down to like a 6 a.m. to 7:50 a.m., then an 8 to 9:50 a.m., 10 to 11:50 a.m. And also we were going to dedicate 3 of the early morning sections just to junior team for our kids. And then we were thinking about, we have digital signage and flat screens around the gym to actually have a countdown clock and set it for 15 minutes with kind of a warning around 3 minutes. So much like you would use in a competition, so that, you know, people are moving along stations or along zones within a given amount of time period. And so that's going to be, you know, it buzzes after 15 minutes. And so there might be some people on deck who are sitting, you know, 6 feet apart on the benches to wait for a line that they may want. But once that timer goes off, then, you know, people kind of move through. So those are some of the things that we were thinking about in terms of timing. And with 50 people and the time slots Monday through Friday at that 6 a.m. to 11, you can run through about 400 people in one day. So I don't know if that helps, but we were talking about doing something like this.
Great. Yeah, no, thanks for that. As you went through those calculations, did you do any surveying of your members, or do you have some existing data that you were relying on for the non-peak times? Like whether, so the question about whether your members would be able to spread out throughout the day, given work schedules and things like that.
No, that's a great question, Garnet. I think, you know, I think people will still continue to work remotely more so. And if you want to climb, you're going to find the time to climb. We are going to try and limit it to no more than 2 reservations per week initially. And we are going to limit it to members only initially, just because we have, you know, there are going to be enough members, I believe, that would want to come in, and we want to serve them first. And then slowly try and assess what the time slots are. And you know, I think climbers who haven't been climbing for 6, 7, 8 weeks will find the time to come in on these off-peak slots.
Yes, yeah, and I think you're right there. All of the members of the world can't wait to get back in the gym. So that's one thing we all have going for us. I was going to move on to the next question since we're getting close to our hour, and I was going to unmute Mark Grossman from Monument to speak on that question we had earlier regarding waivers. I see a lot of upvotes on his comment in the question box. So you should be ready to go, Mark. What would you like to say on that respect?
Hi, everybody. Before I talk about that, I just want to give a comment on that last discussion. Chelsea Piers in New York used to have, well, still has adult soccer leagues, and they had a 300-team waiting list. You could get a time at 4 in the morning or 2 in the morning. So I think to that point, I think there's so much pent-up desire to get back out there. I think they'll come in anytime. So anyway, but what do I know?
Well, and 4 a.m. in New York is like 2 p.m. in many other cities.
That's right.
Yeah.
That's right. No, so the only thing I wanted to, there was a question before about waivers. Zach Morgan, who many of you know, who's our Director of Claims and Risk Management, we're currently, he's heading up research with several attorneys that we know, some involved with CWA, and then in other areas of sport and recreation, to see what the current lay of the land is, suggestions on, adding coronavirus or communicable disease language to current waivers. So we will get back to everyone. We'll get back to you, of course, and then you can spread the word.
Great. Yeah, and Zach, just so everyone knows, Zach from Monuments also going to be on our is on our reopening committee that's working on getting some more concrete guidance around a lot of these questions for you guys. So if there's anything to add into that, that'll be another place to find that information.
Great. Thank you.
Yeah. All right. See, I think we have time for one more question here, or if anyone wants to throw their hand in the air, I'll let you, speak out and say your piece as well. So we've got a couple questions here around. So I'm trying to see if there's a couple that we can compress into one. No, here's an interesting one that I'd love to hear some different responses around staff climbing. So. Have folks out there considered communication to your staff about when they can climb during these reduced occupancy scenarios? Anyone setting apart separate after-hours slots for staff? All right. Yeah, that's probably a little bit further down the line for some of you after dealing with the member issues. Let's see. Shameless plug here in the question. Someone was asking about the CWA's forum, which we just started in response to this pandemic to give people a place to ask questions and speak to each other. So far, no one's really made use of that. We would love for you guys to use that. So that is there for you. We check it, hopefully, to see comments from everyone. So far, no one's taken advantage of that, but please do. The CWA staff and hopefully all of your co-members and co-owners will be on there to help answer any questions that you have. I'd love to see you guys start using that in any way that you see that it would be useful. Another question on here about posters. So yes, the CWA is going to be putting out Climb Smart branded posters directed towards your members and customers around what should be expected from them in terms of their own personal hygiene. And then we're also considering putting out posters communicating what you guys are doing to keep your customers safe. That one's a little bit harder since there might be a variety of policies out there, but I think that'd be a great way to, just to help communicate what sorts of measures are being done to make people feel comfortable once they come back into your gyms. And anything else here that we can combine? All right. Yep. I think we'll. Oh no, let's leave this one. We'll get a couple comments on here. We might go a little bit over the hour, but I think this will be one that a lot of people are considering. Gyms out there banning loose chalk and moving to liquid chalk only. Anyone have any strong feelings for or against that in their own facilities? All right. Yeah, and I think that's going to be quite different around the country. Hopefully, on the personal hygiene side of things, we can find some clear guidance there. And there are a few companies out there, Friction Labs most notably, putting out a higher concentration of alcohol in their chalk. So might be something that you look towards providing for your customers, either for purchase or just for general use. So keep an eye on some of the developments there. And I believe some other chalks have fairly high concentrations, but you should call or contact the manufacturers to find out exactly if that's something you're looking for. I believe Flash's product is a similarly high concentration. So thanks for all of your time today. Like as I mentioned, on Thursday, we're going to have a panel discussion with a few owners around financial planning, scenario planning, things that you might be taking into account as you begin to look look past reopening and into that rebuilding phase. What's it going to take you to get back to where you were a few months ago? So yeah, please tune in for that, and there'll be a whole nother question and answer time. So come prepared with any questions you might have around financial or scenario planning. And as always, we're here for you. That forum is there for you as well if you'd like to type in some questions there. Any further questions you have about any of these topics or comments or ideas that you'd like us to explore for you, feel free to get in touch with us. Just send an email or give us a phone call, and we'll always be here for you. So that'll do it for today, and we'll see you on the next call. Thanks for all your time, everyone, and see you soon.